While you are pregnant, you will have quite a few appointments to make sure that you and your baby is healthy. One thing that you will be checked is your blood pressure. Having high blood pressure during pregnancy can be a cause for concern. So doctors will do some tests to check for a condition called preeclampsia. But what is preeclampsia?
Preeclampsia is the presence of hypertension and proteinuria after 20 weeks of a pregnancy in a previously non-hypertensive patient. However, eclampsia is a severe form of preeclampsia. It involves the same symptoms, but it also results in seizures.
Epidemiology. Preeclampsia affects 5 to 7% of all pregnant women worldwide and up to 20% of all the 13 million preterm births each year. Moreover, it is responsible for 500,000 fetal deaths per year and 70,000 maternal deaths per year.
The research in UAE included 900 pregnant women, with 126 in the first trimester, 228 in the second trimester, and 546 in the third trimester. And hypertension was discovered in 28 of the participants with percentage of 3.1. COVID-19 implications. Infection with COVID-19 is linked to cardiovascular problems. It can lead to heart disease, stroke in addition to neurological condition, moreover become fatal for both mother and baby.
Patients with severe symptoms have a higher risk of cesarean delivery, postpartum hemorrhage, hypertensive disorders, and preterm birth.
It is not known what factors increase the chance of coronavirus being transmitted from a pregnant mother to her unborn child. However, stillbirth and newborn death rates were low.
For the nursing management, nurse should assess blood pressure, fetal heart rate, headache, and visual disturbance.
Nurses should assist couples in identifying their problems.
Nurse should maintain a calm, no humanist atmosphere, evaluate medication effectiveness, and administer antihypertensive agents. Place the woman in left lateral recumbent position.
Preeclampsia can affect a pregnancy, causing damage to the kidney, liver, brain, and other organs. The placenta may also be affected. Preterm birth and pregnancy loss or stillbirth are outcomes of this disease. Preeclampsia can progress to eclampsia, which is characterized by seizures.
Labor. Your doctor can decide to induce labor. You will most likely deliver vaginally. The sooner in your pregnancy you are, the more likely you are to need a cesarean delivery.
In postpartum, preeclampsia can occur between 48 hours and 6 weeks after a woman gives birth. A condition known as postpartum preeclampsia is when a woman has seizures within 72 hours of giving birth. It can develop rapidly if left untreated, leading to stroke or death.
Newborn infant. There are many complications later in life, even though they were born at full term. Learning disabilities, cerebral palsy, epilepsy, deafness, and blindness. Infants who did not grow normally in the womb are more likely to develop diabetes, congestive heart failure, and high blood pressure later in life. Preeclampsia can cause problems to the placenta. The fetus is at risk of lack of oxygen and nutrients.
Lactation process. Breastfeeding is also possible. Eclampsia drugs can cause low milk supply. And don't forget to discuss your plans with your lactation consultant.
For the treatment, when calcium intake is low, 900 mg per day calcium supplementation during pregnancy is recommended. Preventing preeclampsia in women at high risk of developing the condition with low dose of aspirin, 75 mg.
Preventing eclampsia in women with serious preeclampsia with magnesium sulfate. Moreover, medication in the weeks postpartum should be adjusted to maintain a systolic blood pressure not higher than 150 and diastolic blood pressure not higher than 100. Propranolol and labetalol are preferred due to lower levels in breast milk compared to some other medications. شمة راشد،
العنود علي،
نادية عيسى،
شيماء جابر.